On-the-scene coverage of ACC.14 is supported by Janssen Pharmaceuticals, Incorporated.
I'm Peter Block here in Washington, D.C. at the ACC annual meeting for On the Scene. You've heard a lot from me and others that I've interviewed about PCSK9, and here is yet another one. But this one actually is a terrific one. PCSK9 in patients who are statin intolerant. That's really the group of patients where it may have a huge effect. With me is Eric Stroes from Amsterdam. So Eric, tell me about your study, yet another one, but really, I think perhaps the most interesting.
I like you already, that you like the PCSK9 study and this study. Well, to make it very short, we see patients who don't tolerate statins every day, and the problem is we don't have an alternative. So now we tried to see what PCSK9 inhibition would do in these patients who don't tolerate any statin, yet are at very high cardiovascular risk.
Okay, now what I've learned from the other people that I've interviewed using PCSK9 is that it reduces cholesterol, LDL cholesterol specifically, significantly, but many of those patients were taking other cholesterol-lowering drugs, including statins. So in your group where they can't take statins, what kind of reductions did you see?
Well, first let's start with where are they? You know, they're actually at baseline at 195 milligram per deciliter, so 5 millimolars. That's huge.
That's LDL.
That's LDL. So that's the same as in the early intervention trials in 1993, the 4S study. So basically very high baseline, and then we see a 53 to 56% LDL cholesterol reduction without any statin. So that's massive reduction, which brings them to goal at approximately 78 to 90% of patients.
So if you add something else, and I'm sure some of your patients had other medications, what do you add to that if they're statin intolerant, or is that not necessary?
If you add it on top of PCSK9, you mean?
Correct.
Well, in this case, we didn't do that because basically some of them use a very low dose of statin, and on top of the very low statin was as effective. But monotherapy was very effective, and here giving only this already brought them to baseline, to goal level, so that was pretty good.
All right, so you've gotten to goal simply with the use of this monoclonal antibody. We can talk about what needs to be done, which is the long-term follow-up and outcomes, of course.
Sure, it needs to be awaited, but for these patients who don't have any alternative currently, I do hope that we can proceed with this effective therapy. And mind you, only 8% still had some myalgia complaints. So going from all of them to 8%, that's an outstanding side effect profile.
Okay, so for all of those out there that are taking care of the statin intolerant patients, and this is an important group, let me ask you, do you think these monoclonal antibodies are going to be the best way of dealing with these patients in the near future?
Well, for all of you out there who actually have the frustrating experience of not being able to give these patients anything, this is a very effective, robust LDL lowering with very few side effects. So I think this is going to be an outstanding option. And now it's no longer an untreatable disease. We can actually treat it safely and effectively.
Well, if you wanted a short version of what all this is going to come to, that's a great way to put it together. Thank you, Eric.
Thank you.